The Cleveland schools are about to talk to your kids about sex. Hello again, everyone. I'm Rick Jackson. This is Ideas, and now that we have your attention, let me explain the reasons behind the district's plan to do more than educate kids in reading, writing, and arithmetic. In Cleveland, the number of teenagers giving birth is almost double the state average. HIV infection has quadrupled in the past 4 years, and rates of chlamydia and gonorrhea are well above both state and national averages. Statistics are alarming enough that district leaders were convinced they needed a bold approach to combat the problems of teenage sex. So the Cleveland Municipal Schools are implementing a new sex education program for all grades, starting in kindergarten, running through high school. No other school system in the country has anything like it. ideastream's Lisa Ann Pinkerton reports.
Out of the 12 Cleveland high schools last year, 3 of them reported around 40 students visibly pregnant. This year, at least one 5th grader thought she was pregnant. To Cuyahoga County Commissioner Peter Lawson-Jones, these reports affect more than the families of the children involved. They carry social costs that burden the community.
Those social costs are passed along to taxpayers and are much more expensive when you try to remedy what's occurred as opposed to prevent teenage pregnancy and, again, the spread of sexually transmitted diseases.
Traditionally in Cleveland, health and sexuality is taught to 5th and 6th grade students. But to truly bring Cleveland's high pregnancy and STD rates down, the Cleveland Public Schools, the Cleveland Health Department, and the Cuyahoga County Board of Health say all grades should teach age-appropriate material on sexuality.
The evidence indicates that when we do not talk to our children about these and other important issues, our children become more at risk.
When the Cleveland Schools and the Health Department decided to establish a curriculum-wide program, they had very few models nationally to follow. So the program announced this week was created from the ground up, using various programs that have been successful throughout the country.
At a subway stop downtown, most people think giving children as much information as possible about sexuality is important, as long as it's age-appropriate.
I mean, they're going to learn it anyways, but, you know, a lot of young kids know too much already.
It's a lot of predators out here, too. So, you know, if they feel like, you know, they've been touched wrong or whatever, and they know what part of the body that they should be touching, they can tell their mom or dad.
If they get a head start today, just like our computer technology, they're a lot further ahead when they get in high school.
Cleveland's new program is being paid for by Cuyahoga County to the tune of $1.2 million a year. If it's successful, the county hopes to expand it.
We're hoping that this is going to be the pilot, and we're hoping that we can duplicate it in other communities as they get ready for it.
Cleveland's first classes in the new sex ed curriculum begin in November, but it'll be several years before researchers know if it's working.
Now, Lisa, there have to be different elements for little kids versus big kids. What's the new stuff?
Well, for the little kids, K through 3, the children are going to learn about inappropriate touching and also viruses. So, you know, what is your personal space and how to assertively say, no, stop it, leave me alone.
Okay. Who we didn't hear from in that report you did was Superintendent Saunders.
Sanders?
Yeah.
Yes, and he is concerned about this, obviously, and he thinks that you know, children who succumb to these troubles, they will, you know, they may drop out of school, they may do poor academically, and that hurts the whole system as a whole.
Okay. So we know what the city has, and we know what the state tells schools they do. What about the charter schools? Any interest there?
Well, the state doesn't require sex education. If you are going to teach it, you have to teach an abstinence-based curriculum, and you may talk about contraceptives, but since it's not required, charter schools they don't have to, so you may not find that there.
Thanks, Lisa. We know the whole country will be watching. Thanks. Well, older students